Hello, everyone. This is Scott King with Becker's Healthcare. Thank you for joining us for today's webinar, Don't Let Fragmented Systems Limit Performance. Before we begin, I'd like to walk us through a few quick housekeeping instructions. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have issues with audio or visuals, just try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. With that, I'm pleased to introduce today's speakers, Meade Monger, Chief Executive Officer, Omniscient Health, Thijn van der Heijden, President, North America, Omniscient Health, and Nico Banchero, President, South America, Omniscient Health. Thank you, Meade, Thijn, and Nico for being here today, and I'll now turn the floor over to you to get us started.
Thank you, Scott. Hi, everyone. Thanks for joining us today. My name is Meade. I will start the presentation and we'll be followed by my partners, Thijn and Nico. We have been developing integrated data platforms together for about a decade and a half. Our company is Omniscient Health. We're data scientists with strong expertise in accounting, business, technology, and healthcare. We're a very highly educated group, Ph.Ds, MBAs, CPAs, Masters of IT and Data Science. And what we do is rapidly develop comprehensive data platforms for real-time information and recording across the business, for automated accounting and business processes. And we have many experiences working with healthcare provider organizations using different software systems and have challenging information management. So starting with the values of a centralized platform, the key, of course, is everything about the business in one place. And also not just collecting data from all the locations and systems, but consistently formatting them into a common data model so that you can see all the information enterprise-wide across the business. And then you can also use that to automate accounting function and administrative processes where you may have a lot of people doing manual clerical work. And then as a result, you can also centralize a lot of the business functions. So rather than do payroll at the location, at the practice level, billing at the practice level, those things, you can centralize it at the corporate level. And another real key aspect of this is a capitalized asset. This is an asset that you build, that you own, and it's not an expense that is an ongoing feature. So unifying healthcare data. The situation is that many healthcare providers have many different systems and disparate technologies. They question whether to migrate to a common system or integrate them. And some take much longer than they should, which often leads to roadblocks around growth, creating morale issues of having to work with such manual data and that sort of thing. And you can move to a common data platform fast and affordably, as fast as 3 months. And we'll talk about that process here in a moment. Information is everywhere, yet many healthcare organizations struggle to have automated real-time data that they need. They are challenged with fragmented, non-integrated systems, despite having abundant data. Some of the types of healthcare provider organizations most affected by this issue are healthcare system roll-ups and multi-facility networks, where there's acquisitions that often include many different types of EHR or PMS software, and data from different systems that's in different formats and difficult to pull together and work with. Larger hospitals also have similar issues, but often have vast volumes of structured and unstructured data where it's difficult to know how to understand what is really happening. Departments often operate in silos with niche tools, and then also clinically integrated networks, where participating entities have different EHR, different practice management systems, and aggregating data for reporting, like quality reporting, HEDIS reporting, can be very labor intensive. So we are making the case for a unified integrated platform. And just to walk through some of the comparisons between disparate systems and the integrated platform, starting with lack of visibility. With disparate systems, it's difficult to obtain a comprehensive view of operations. especially in a timely manner. And with an integrated platform, you have enterprise-wide reporting with real-time visibility into the information across the business and operations. With manual business processes, the disparate systems or inefficient workflows that also often require a lot of manual clerical efforts and a lot of redundant tasks. With an integrated platform, automating data between systems and integrating the data reduces a lot of that manual entry. High cost of managing this process, we've actually been quite blown away with situations where we've seen where the company may be paying hundreds of dollars a month per location, per system to get the data, and it's not even mapped to a common data set. And this replaces that. This is, again, your own asset. You eliminate that software expense, and we've seen literally savings of 7 digits in moving to this integrated platform. Operational inconsistencies have decentralized functions that do things differently at the practice level. And again, if you have the integrated data platform, you can centralize business processes such as payroll and billing and things like that. And then errors and burnout. Errors that are costly and frustrations that cause a lot of burnout and impact employee morale. And with the integrated platform, you have real-time information to accurate, up-to-date information across systems, real-time information. So now to share some success stories. This is a situation where it's an acquisition roll-up of a healthcare provider with hundreds of locations across the U.S. on different EHR and PMS systems, and 30 different systems that we connected all to one data platform and mapped to a common data set. Before the integrated platform, there were a large team manually collecting data from each location and assembling into reports for management to view, and often weeks after the fact. Manual accounting and functional processes, like payroll was manual, revenue recognition was manual, and also decentralized. The processes took place at the practice level, inconsistent ways, extra cost of doing that. After an integrated platform, it resulted in real-time enterprise-wide reporting and dashboards, automated accounting and administrative functions, and centralized billing, payroll, and accounting. The next success story is another multi-facility provider with healthcare, with facilities across the U.S. And they were trying to go public, but it was taking them 8 weeks to close the books. It was a very manual process, very large team of people working on massive spreadsheets. What we did was put in an integrated platform. But before that happened, the situation was, like, for example, with doctor compensation, every doctor has unique contract terms, and payroll processes were performed on numerous large Excel workbooks by a large team of people on a full-time basis. Similarly, revenue recognition process occurred on spreadsheets with a large team of people, and literally these workbooks, many of them took minutes to open. They were so large. So after having the integrated platform, we automated the month-end close, transforming it to a one-week close process. And revenue and collections data were collected on a real-time basis across all locations and mapped to a common data model. And so that was then used to take doctor contracts data and apply that to revenue and collections data to calculate the doctor pay. And then with revenue recognition, methodology was developed and programmed to provide revenue according to GAAP through an algorithm. And this process was signed off by the auditor. So a good success story there. This is a situation with a large hospital system with dozens of hospitals. And they have an Epic system with back-end data in solutions you may be familiar with. If you have Epic, the Caboodle and Clarity, literally consisting of thousands of data tables. So what we did was we put in an integrated data platform here, but before that happened, the teams were creating numerous tables for reporting and dashboards that aren't consistent and questionable about accuracy. Very long process to find and get information needed, often getting lost in the details. And with the data platform, a gold layer data set was available with key information that everyone uses for the single source of truth. So no longer arguing about whether the information is accurate or not, and instead time spent on taking action rather than creating reports. Here's another case study with Independent Practice Association, where the administrative sponsor or the organizing entity is responsible for collecting information from hundreds of independent practices in the IPA. And the administrative sponsor literally was collecting a data file from each of the different practices that were part of the IPA. And of course, all coming in different formats, all coming in different ways, some by PDF, some by Excel. I mean, you can imagine. And so what was done was a process was set up where the participating entities could feed their data into a shared data source that was then mapped to a common data set so that all the reporting across the IPA could be automated and done without having to use a large team of people. So kind of summarizing the capabilities of the common data platform, these are what we find are most often the benefits or the types of things that are done with the common data platform. One is accounting automation, where the data comes right from each PMS into the data platform and modeled to a common data set with automated journal entries that are created that are imported into the accounting system. Enterprise-wide reporting, where information across the business is formatted commonly, as I've been talking about. And so that's the ease of reporting is automatically done across the business in various ways. And then real-time business intelligence, dashboards can be set up, analytics can be done, including self-service analytics, where everybody's looking at the same data. Doctor payroll automation, I talked about this example where doctor contract terms can be applied to like revenue or collections data, and automatically the payroll is calculated, providing pay statements with the details for the doctors. And we've seen in that situation, we've seen where a significant amount of calls stop asking questions about why the pay is what it was. And then standardized clinical operations. I think this is really interesting, where the different treatments are all mapped to a common data model, and practices can be evaluated based on certain diagnoses or episodes, where they can look for set standards and set consistent treatments across different episodes. Systematic performance scorecards, where everyone is measured in the same way. You have scorecards that are cut by regional managers, by facility managers, by doctors, and it's the facts with the scorecard showing the facts that are discussed on a regular basis with the team. Revenue recognition, I talked about with the gap-based methodologies applying to the data. Cash transaction automation. This is where bank feeds can be incorporated into the common data model for daily cash reporting, but also comparing that cash reporting to the postings at the location level. Acquisition integration. Thijn will probably touch on this, but it's very fast. Acquire a new company, get them connected to the data model, and then talked about the technology cost reduction of this is now your own asset. You're not paying a lot of software fees to get data from all your different locations. So the process is, it's critical to form a cross-functional team to really understand the business requirements and develop the blueprint that then a prototype can be developed by extracting data while then iterating that prototype while connecting to all the different systems, and so that it can become fully operational. And we typically see this take about a 3-month process or so to where the common data model is built, the basic dashboards are operational, and you can start to automate processes. So the deliverables include, of course, the common data platform where all systems are tied together with near real-time updates that can then provide enterprise-wide reporting and business intelligence, and then process automation once you have all the data in one place. And I've given some examples of that, as well as centralizing the business functions because you have all that data available in one place. But I'll stop there and turn it over to my partner, Thijn.
Thank you, Meade. So Meade spoke a lot about the things you could do in an integrated platform and some of the benefits, some of the cost reductions you could drive. And what I would like to do the next 10 to 15 minutes is to walk a little bit, go a little bit deeper, look at more from a technology point of view, and share a couple of thoughts of ideas with you, which you hopefully can take home and think about. So in Meade's conversation, he really spoke about 4 key items. Well, connecting the systems. So we need to find ways to connect to a cloud-based on-premise system. Tools you can use there as an API or an ODBC connector to get the data out of it. The other thing Meade spoke about is a common data set. So where data is mapped to a common structure, which is the third item on the slide here, is which you then can use for your enterprise reporting. So that everybody uses that same set of data, same set of definitions. And then finally, as part of that common data set or that reporting, is then you can hopefully replace some of this clerical or repetitive work with some forms of automation to allow people to do, not to work harder, but to work smarter. So what I want to do in this slide is kind of walk you through an illustrative current state of a hypothetical company acting in the healthcare industry. And in this situation, this organization has various departments, and every department has typically their own system. So in the case of finance accounting, they have an ERP system. And on the other hand, in your clinical/RCM work, you might have more than one PMS, EMR, EHR system where they work from. And from these different systems, in order to understand what's happening, the RCM team has to run reports to see how it's ongoing, and then collect that and share that with colleagues, making sure that everything is running well. The challenge of this situation is to say every month, every quarter, there is a leadership meeting. So we need to bundle this information together across the departments, creating kind of this common view, common understanding for the leadership team, what is happening across the organization. So when we take this picture into memory and we think about, well, what are some of the challenges when we think about, well, how to work in this organization where it looks like that people are acting kind of in their own silo within a department and run their day-to-day business. So as Meade kind of alluded to is, well, can we address some of these challenges? So what I want to do is kind of go counterclockwise from the top right around the image. So I just mentioned the RCM team. So just imagine that you have more than one EMR, EHR system, and you just want to get a view of what are your daily AR metrics, which would mean for the RCM team that they had to go run reports across your multiple EMR systems, combine them and see what's happening. And that is not, I would say, the best use of the time. On the other hand, it might be if you have those multiple EMR, EHR systems as well, you might make the decision, hey, let's go to a single system. But it does mean if you do that, well, one, it's costly from an operational perspective, but also on the other hand, all your existing reporting might be redeveloped, redone, and rethought through. Then thirdly is what happens when you do an acquisition. You want to expand the footprint of your organization, and as a result of it, this acquisition brings in new systems. New systems means, well, you can't yet integrate them directly with your current, say, technology stack, so you need to find some ad hoc reporting to understand what's happening there. And when you have these different systems, people create their own reports, and it's likely they will also have their own set of definitions how to interpret the data. So it might be that when you look across those reports, not every metric or every KPI is defined the same. So when you then come to the last point, like that monthly leadership meeting, it might well be that time is spent to reconcile the numbers such that the data is coherent and explaining the situation properly. What we have seen happening is that the decision might be, okay, let's invest a lot of money, a lot of time to go to kind of these larger enterprise-wide systems where we can run our accounting functionality in, or we can do, for instance, Epic in a large hospital who would hopefully resolve some of these challenges from a reporting and operational point of view. But then it might not be the option for everybody. So what I want to do in the following slide, which I'll bring up the screen here, is, well, what is our approach we typically take when it comes to integrating this platform and how to kind of simplify that reporting. So we're going to kind of cut the initial picture into, and we only focus on the top piece, or on the existing systems you might have in place. So what we want to do is break the data silos across department. And in order to do that, what we do, and that's what we start talking about, is we want to pull kind of the raw data we need from the different systems. So we'll pull information out of the ERP to get the raw accounting and finance data, the necessary information around patients and AR, let's pull that into a raw environment. The same maybe for HR, payroll-related information. Almost every system has a form, either if they're cloud-based or on-premise, to extract that data. For most cloud-based systems, that's what's called an API. And if it's running on a local server in somewhere in your basement, there's typically a database behind it where you can typically tap into and consume that data out of it into your centralized raw data layer. This raw data layer is just the data as is, as it comes from the system. That's what we will call here the bronze or raw layer. The next step, that's where we start entering what we call either the silver layer or the staging layer. And this is typically where we start building out this common data set. So if we would have more than one PMS system and we have patient data, we would map that to a common structure where we map all the patient information. So then when you want to know how many individual patients do I have, you would dedupe it and make sure you have all the associated information in a structure you can actually report from. The next step in this process is where we go from this standardized common data set into what we call either a semantic or a gold layer, or even, to put it more boldly, the single source of truth we want to use moving forward. In this gold layer, that's where we define the different definitions we want to use in our reports, or any other derived metrics from our original data in our silver layer. So like, for instance, we want to measure how many new patients we've seen in the last couple of weeks. Then we have to define what do we mean with new, and what is the different time period we want to use there. Now that we have that gold or semantic layer established, we can now expose this single source of truth to any form of reporting we have downstream. It can be tools such as Tableau, Power BI, people might be aware of, or just simpler tools like Excel to slice and dice the data at your own liking. With that in place, now that you can imagine that we have the single source of truth, everybody's working from the same data set and should therefore be reporting the same type of numbers. And that then also kind of means that if we have to develop a report for the executive team, that would follow the same structure. So instead of that you have to stitch data together, you would pull it directly out of that gold or semantic layer, allowing you to actually see what's happening across the organization. So let's think back of some of the challenges we saw, especially when it was around changing systems. So if you're making the decision, hey, I'm going to change my PMS from one vendor to another, what is then the type of work we would need to do to make sure that we have visibility? The steps ahead of us is that first of all, we need to make sure we can connect the system so that the data lands in the raw layer. And then secondly, and that's actually also the last step, we need to map the data we are interested in into our common data set. And once that has happened, all the downstream processes, all the way to reporting, are still working. So we see very quickly what is happening in that new PMS or EMR system. And I would follow it exactly the same story when we do a new acquisition. So during the phase that you have identified this new acquisition, you likely have done some due diligence around, hey, these are the type of systems. So when it actually becomes part of your organization, you should be able to tap directly into that raw data set. Again, mapping the data into your raw layer, doing the second step of adding it to your common data set. And then again, all the definitions you already have in place should also apply to that data set, and then for any subsequent reporting. So you kind of, for both a change in system as well as an acquisition, you would follow exactly the same protocol. I do want to stress here is, and I did mention it a couple of minutes ago, is that the nice thing of having such a single source of truth is you have standardized your definition. So across the organization, you have to agree upon how you interpret things and how you measure things. And sometimes what we've seen in an organization, that there's sometimes small differences how one department measures things across the other. And then to finally, what Meade has mentioned around automation, because a lot of the reporting now just is being sourced from a single source of truth, you should be able to automate that fully, taking away any form of repetitive or recurring activities. So when we think about this integrated platform, the data allows you to connect to different systems. Even if you switch out systems, it allows you that you maintain a lot of the downstream processes. Also, because of a lot of the standardization which is applied, you don't spend as much time in FTEs or expressed in dollars in refreshing existing reports. And because we try to simplify how you interact with the data, typically what we observe is that the IT team doesn't have to spend as much time maintaining all these different systems and also different reporting structures. As a result of that, then it's much easier to think through security, data governance, and data management, and therefore driving typically a somewhat lower operational spend on the IT side. So then the question could be brought up, well, why should we build it ourselves? Why not involve it with a third party out there who do this on a day-to-day business? So one of the challenges is, at least from my perspective, when you think about why or should I use or should I not use a third-party data aggregator? So first of all, something we've mentioned in this session before is how costs are being captured. So on the digital asset side, it's a CapEx spend with, I would say, fairly small OpEx moving forward. Actually, when you use a third party, it's typically a somewhat larger monthly bill you have to pay to see your data being processed. On the other hand, when we think about data standardization, it's then something you fully own and understand what's happening to your data. Typically, every organization has their own little quirks and what they do in every system, and you are able to capture these quirks. For a third party, they don't really use your systems on a day-to-day basis. So initially, your standardized data might not look as good as what you have given to them. Some of the other challenges is, and this will combine the third and fourth bullet point, is in order to get updated information, the third party has to actually extract data from your systems, and they typically do that only once a day. And the other challenge is, as it leaves your premise, you have very little visibility is what is happening with your data and who has access to it. And if you have an internal asset, it's something you, in both cases, can 100% control. And then finally, typically, as these platforms mature over time, you want to have some custom work done, custom reports, different systems, third-party information you want to get included in your reporting environment. That might be a challenge when you're 100% dependent on a third party. So I want to leave these thoughts with you and then hand it over to my dear colleague, Nico.
Thank you, Thijn. So I'm going to share my screen quickly because for the following part of the presentation. We wanted to help you visualize a little bit of what an instance that has all these concepts looks like, and try to cover some of the aspects that Thijn and Meade have been discussing. So I want to start with this mock-up of an application that helps monitor and manage the different integrations or the different data sources throughout a layer architecture. So the layer architecture is the one that Thijn has been referring to, right? So how do we ingest data into a raw layer, then make sure that we integrate all different systems into common concepts, and at the end are able to visualize that information in unified concepts, like, okay, what is a consolidated view of the company, of what a patient is, of what a provider is, what an encounter, and different measures and KPIs. Again, the idea is that we are able to have these benefits, right? Traceability, flexibility, scalability, and maintainability of the different logics that go throughout these layers. And in the sense of what we are monitoring, basically we're monitoring the status of different systems, locations, different stages that the data flows through, and different concepts. So systems can be Epic, Cerner, Allscripts. Locations can be anything that the business requires to track as a location. The stages are the one that we refer to as the raw to the visualization layers, and the different concepts are the ones that are going to be key for the business. And the statuses are going to be, are our systems connected? Are they syncing correctly? Have the processes that synchronize the data finished, or the current processing? Were there any errors? And on the monitoring aspect, what we want to see is how many systems we currently have connected, how many active connectors, how many records are we bringing in, how many errors have happened in an X number of hours or days, to make sure that the data is healthy or not, and keep track of what's going on at the different stages of the data flow journey. So, for instance, when we look at things throughout the lens of one particular system, we can see whether or not the stage layer has been completely loaded. For instance, in this row here, we can see for Epic that was connected for our main campus location. It's actively loading information to the raw layer, or for Cerner, this other location, it's currently already making sure that the data is flowing from raw to stage, and to keep track of all the different activity in one place. And this is for the first layer, which will be anything connected to source systems. And we can do this for all the different layers, right? So we can also see what's going on at the unified or reference level. So when we talk about unified patients, that's likely all going to end up living in a reference table for patients. Okay, which systems are connected to that? Is the data refresh or not? Were there errors? See any details, and so forth. And this speaks to the monitoring aspect of this. We can also speak to the management aspect of keeping a clean and centralized repository of information for all connectors, right? So we think of this mostly in terms of locations and connectors, or system connectors. So locations are physical or virtual, in some cases, locations that we actually want to keep an eye on, and they have different connectors or different systems that are being used in those particular locations. And the idea is that we can manage that through a single source of truth, and we can have, for instance, add new locations. There are different types, and see them in here, and the same for the different connectors. We can manage that through saying, for instance, for the main campus, I'm going to connect to Cerner using this parameter information, these secrets, and so forth. And there's only one place where we could keep track of all of that information. And we can actually see, for instance, for the main campus, okay, how many systems I'm connecting to, from where I'm getting data. Can I test these connections? Can I see the logs? and make sure I have one place to go where I keep track of all this information. Of course, in the backend, all this information is then being used by different processes and shops that run on schedule and connect to these systems on whatever schedule is required. But in the end, you can also have one place to manage that information. And all of this is related to how we are actually pulling the information, transforming the information, and keeping that information in our data, in our common data model. But of course, in the end, the idea is to use this information. And for that, we wanted to show you also a common reporting bundle that we typically use. And in this case, it's for a client, and we have anonymized data for where we can see the different aspects of the business, starting with performance trends, for instance. The idea is that you can see information at different dimensions and different time scales. For instance, here I'm looking at a couple of quarters from 2024. I can drill into some categorization that I'll talk about in a minute. We can drill down by the information by the primary payer of the different transactions. We can filter by location, by provider, or even by the treatment category. Some of this data will be directly pulled in from the source systems, and other needs to be categorized and treated throughout the different stages of the data flow that we've been discussing. But in this case, for instance, just to show performance, we're looking at volumes, RVUs, and allowed amount for 6 months in a given year. And you can see the information broken down by month here in a tabular fashion and showing year-over-year changes or even month-to-month changes. And if you want to drill down into that year-over-year view, for instance, you can see January to January of one year versus the other for different measures that you can select. And here we have like some of the most common ones that are related to the number of encounters, dollars in amount and paid amounts, volume of transactions, and RVU. And for all of those, we can see the changes year over year for the same time period. Again, this is for the entire business, but can be seen by different dimensions that the data allows us to slice and dice. We can, for instance, a common view is to see information by payer mix. For instance, in here, we're seeing across time, what does the payer mix look like? In this case, we have captured at the top 3 payers and group all others into another bucket, but in general, to see how it trends over time and see if there are any expected changes occurring or not, see them in the data. Same for the provider level information. If you want to drill down into the actual provider performance, there are views that we usually have for that based on the data that can be tracked in this type of systems. For instance, in here, we're looking at performance for one location, for all the providers in that location, for all categories of treatments. And we can see the standardization of what the performance looks like for a provider in one axis, and in this case, the paid amount that actually happened for each of these providers, so we can get a sense of what does the ratio of paid over RVU looks like for each of these providers, and do comparisons and make sure that the performance is aligned to what is expected in terms of providers. All of these I've been showing is highly correlated to financial information and performance. You can also see operational performance information. In this case, we're looking at appointments by month. The idea here is that we can see trends for this and keep track of all the different statuses. For instance, if there are different initiatives by the operations team to improve the number of appointments that are actually kept after booking, is that something that we can see as paying off or not? And we can drill down into different ratios that are custom made. In this case, I'm looking at ratios for the different statuses of the appointments and what is the ratio of cancel overall, the ratio of cancel appointments year over year, cancel over confirm, and so forth. And we can see change year over year to show how the business is progressing in that regard. And again, if there are any initiatives that need to be tracked, that can happen throughout this information. And one more aspect that's something that we end up usually building on top of this data is RCM tools. So in this case, we are looking at data by month for what's contractually earned. So in terms of what Meade was talking about before, what's in the contracts that should have been paid versus what was allowed by the different payers and what was actually collected or paid in the end month by month. So we can focus on the different gaps, and we can see that this is usually the case. There are gaps from one to the other. There are transformations in the data depending on the business rules, on the contract information, and such that allows us to categorize the transactions, for instance, into the buckets of accepted, denied, or partially denied in terms of what was allowed by the payers, and the same for the categorization for the payments. For each transaction, we categorize into different buckets that we can then drill into. For instance, if I now go to the denial summary view, we can see for this gap in between the contractual and the allowed, what was the reasoning behind all the denials, and we can categorize that. In this case, you can see for a given year, 2023, there are $9.8 million that were denied, and out of that, 3.5 fell into the more documentation needed category. So, of course, this can be drilled down into many different dimensions. In this case, I'm looking by payer, and you can see 1.1 for Medicare Advantage. And when I click on that, I can see the trend by month, and I can see where, in particular, in this case, where are the different outstanding months where we had issues with the documentation. And we can use this information to drive different initiatives to attack the more relevant aspects of this. And finally, since in many cases what we're going to end up having in this sort of infrastructure is very granular data, it can be up to the transactional level. It's not going to be like that. So you're able to actually go to an given encounter, see what happened for the particular encounter. In this case, for this encounter that was partially denied, I can see here below the details and see the different procedures that took place during that encounter. And for each of those, I can even see how much was contractually correct to get paid, how much was actually allowed by the payer, and how much was actually paid for each of those procedures. And again, different initiatives related to RCM will benefit this, and particularly some automation processes can be built on top of this information. With that, Meade, I'll hand it over to you because I think we covered all the one in terms of reporting.
Thanks, Nico. I'm just going to make a few closing comments, and then we can open it up for questions. And I'll first say that healthcare organizations don't need to wait a long time or spend a lot of money to unify their data. A common data model like we've been talking about here can be deployed in as little as 3 months. And typically the way the process works is that once it is built over that 3-month period of time, the dashboards that Nico shared come with that. And then those help to point out, going through that process and looking at those, the results help to point out where there's opportunities to improve efficiencies. And so that's when a lot of the automation takes place. Understanding where there are large teams of people working on processes that now that the common data model is in place, that the computer can do the work instead, and better and faster, and of course cheaper. And you don't have to rip and replace systems for this. We've been doing this for a long time, and have shared some of our success stories. The roadmap is proven, and we hope that these are all reasons why this is a really easy decision for some of you that have this type of situation. It's very fast, as we've talked about. It's very affordable to do in a short period of time. It's relatively straightforward conceptually, and then it's also non-disruptive to the business, because you're really kind of working in the back end of all the systems. And as I hope we've demonstrated, there's a lot of great value that comes out of it in terms of real-time information and automation of business processes. But with that, I think we can pause there and take some questions.
Yes, absolutely. Thank you, Meade, Thijn, and Nico, for a wonderful discussion today. We'll now begin today's Q&A. Audience, please feel free to submit your questions via the Q&A box on your screen. Let's get started with the first question. You're clearly building a solid infrastructure to connect systems across care sites. Once those insights surface, say across ED, clinic, and inpatient settings, what do you recommend for process orchestration to ensure timely action? How do you coordinate human systems and agentic AI across long-running workflows, like patient transitions or care escalations? Or is that handled by another team?
Yeah, it's a great question. As I mentioned, the enterprise-wide reporting of the dashboards are available for use after the first few months of developing this. And the way that we've seen most success with it is it really starts with the management team. And so the management team has a regular cadence where they use this information to talk about where the business is doing well and where the business is not doing so well, and where they need to drill into opportunities. And as Nico demonstrated, everything, once you have all this information in one place, you can cut it by different parts of the business. And so then you push that down. So you focus on, where are your good regions, where are your bad regions, and within those regions, where are your good locations and your bad locations, your good doctors, your bad doctors, et cetera. And it effectively serves as a scorecard where everybody's working with the same type of results, the same information, and sharing facts among each other.
Yeah,
Thijn, is there anything that you wanted to
Yeah, I would
add
like to add one item is it's not always easy for people who are not used to working with data or reporting in general, how to go about this. And so typically what we see is a little bit of hand-holding, like, well, how do I interpret my day-to-day processes? Where do I see deficiency or efficiency? And so going from kind of sometimes what I call a gut feeling approach, like, hey, I think we should do this, to kind of embrace data out there is sometimes a challenge. The other thing I will mention here as well is data governance in general is probably on this call, people have heard garbage in, garbage out. So if you don't do a great job of tracking what you would like to track in a great fashion, it will just become harder to take actions upon it. I mean, the common data is great. I mean, it has shown its value, but we also typically help coach organizations to do a better job around how to better capture data at the beginning versus trying to fix things at the later stage. That's the only thing I would like to add there as well.
Moving on to the next question. If our company is currently paying a software vendor just to collect raw unmapped data from each of our practices, is it easy to switch your common data model approach and not have these costs, as well as have all the data mapped to a consistent data set?
Thijn, you want to take that one?
Yeah, sure. So the short answer is it easy? I would say yes. the work which has to be done, kind of what we laid out in that image, is it's twofold. One is you have to make sure, which is already shown by the third party, that you're able to collect the data, and typically already likely have worked with your third party to map the data so you understand it. So once you have it in-house, then it's really also the next step to take is to cut the umbilical cord with your third party, because at a certain point you also want to stop paying that monthly or recurring bill. But secondly, also what I would say from a security point of view is they typically have access to some of your core systems. And so if there's any time a data breach maybe somewhere happening on the vendor end, you don't want that to be affected for your own company as well. So answer is yes, we have done it in the past, and we typically see, to Meade's point, sometimes up to 7 digits of a cost reduction when we measure it in dollars.
Does our company need an internal team to manage the integrated platform after it is developed?
Yeah, we've seen different ways that companies have handled that. Typically, what's needed is a good data engineer, a good data scientist, and some prefer to do that in-house. Some prefer to have partners. We serve in that role a lot of times on just a kind of regular basis with arrangements like that, or even hybrid type situations. So once it's built, it's relatively straightforward to manage. So they can either have that in-house or rely on an outside partner.
Our company has specific accounting needs that currently requires lots of manipulation of data and extensive calculations. Can that be automated with an algorithm in the integrated platform?
Thijn or Nico, you want to take that one?
Yes. Definitely, we have done automation for accounting processes at different businesses. It does take some time to make sure we account for all the different business rules and make sure that we align with original reporting, let's say. So it's important to have like a good baseline to make sure that we are aligned. But yeah, definitely it's a possibility. Once data is flowing into the common data model on the transformation stage, or when we hit the visualization, all the transformation needed for accounting can also happen as part of such an initiative.
Next question, how difficult is it to get all the data mapped to a common data set and keep it mapped?
It is, I would say, honestly, not difficult. It's a matter of kind of making sure you stay on top of it. Initially, it might be tricky to do all the mapping. For instance, you have your roster in your HR system and you have provider identifiers in your EMR, and you have a very large organization. You might have to spend a couple of days to map, for instance, your HR information to how it's captured in your EMR. But once you have done it, what we typically do is think about the ways to automate it. So if you hire a new individual, make sure that goes into the HR, set up a standard identifier in your EMR, for instance, so it becomes easier to maintain it. But unfortunately, sometimes the initial effort is just sitting down and crunching through the data and make it as clean as possible.
Scott, I like this question from William. Do you mind reading that one, please?
Absolutely. How do you account for missing data elements within the variety of EMRs and other systems? Meaning if you need data elements A, B, C, D for your common data model to work, but a certain version of an EMR only gives you A, B, D.
Yeah, it's a good question. I think generally what we find is if the information is there somewhere, we're going to find it because we're working in the back end of the data. We go into where all the data is stored, and if they're capturing that information, we're going to find it. If they're not, and it's really needed, then the question goes to, okay, what kind of process can we put in place to get it? So, we improvise when we have to. So if it's there, we're going to get it. But if it's not, then we're going to figure out how to start generating it.
Yeah, I think a nice example we've seen often in the past that, for instance, not all the EUB information is properly captured in an EMR or partially. So then typically we go about, can we connect to the clearinghouse you might have in place and get then that the null information into our common data set, so we can actually help the RCM team to understand what's happening in those ways. So those are, it's not uncommon that it happens, but we, to Meade's point, we'll deep dig into the system itself, or we go to the party who should have that information available to supplement the common data model.
Looks like we have time for one final question. What if some of the systems at the practice level are old and do not have APIs?
Thijn, you're the best to answer that one.
Yeah, so most cloud-based systems have an API, especially the ones who are currently out there. If it's an old system, typically what we've seen, it's a legacy on-premise, some iron hardware sitting somewhere in a closet. This sounds bold, but we haven't met an EMR PMS system we were not able to tap into and get the information out of it, either by some creative work from our end or just working with the vendor. Because in the end, from a HIPAA regulation, you should have access to your own data. So, so if it doesn't have an API in that respect, there are typically other ways to access the system, unless the vendor has completely locked off when it's in the cloud. But we haven't experienced that, fortunately.
That's all the time we have for today. I want to thank Meade, Thijn, and Nico for an excellent presentation, as well as Omniscient Health for sponsoring today's webinar. Thank you for joining us today. We hope you have a wonderful rest of your day.
Thank you, everyone.
Thank you.